All right, so this is HSP, right? It's a systemic vasculitis. You know all of this, but you do need to know that the kidneys are involved up to half of the time. Most of the time what we see is very mild involvement with asymptomatic hematuria. This is why we screen patients with HSP and check their urine for the first 3 months or so. Usually it settles down and goes away on its own, but it can be more severe, and that's what we're watching for because those patients may benefit from immunosuppression treatment. If you're going to get kidney involvement, it usually happens within the first 3 months of diagnosis. Okay, so if you have a patient who has a purpuric rash and hematuria and proteinuria, it's probably HSP nephritis or IgA vasculitis nephritis. Okay, just a public service announcement that not all discolored urine is hematuria, right? So if you have a urine dipstick that's positive for blood and you see red blood cells, that's hematuria. That's what you're going to see with IgA or post-infectious or any GN. If the urine dipstick measures positive for heme, but the microscopic doesn't show any red cells, think about myoglobin or hemoglobin in the urine. And then if the urine dipstick's negative and the microscopic's negative, you've got a dye or something in there. So that's medications and food dyes and bituria. And if anyone has ever had bituria. Or uric acid crystals. Those who work with infants, young infants, will probably see this as well. Okay, here's a question for you. A 12-year-old boy notes painless cola-colored urine the day after developing an upper respiratory tract infection. He recalls discolored urine during acute illnesses twice in the past. The most likely diagnosis is A, IgA vasculitis nephritis, or HSP, B, IgA nephropathy, C, post-infectious glomerulonephritis, or D, lupus nephritis. Okay, so it looks like most of the group got that correct. A few people chose post-infectious glomerulonephritis, and what you take away, you're right that this is a glomerular disease, but what you take away is that there was no gap in time, right? There was no 1 to 2 weeks since the infection till he got his hematuria. And he's happened several times in the past too, so you wouldn't expect post-infectious to happen over and over.